concept of the golden ratio, phi. The golden ratio, also known as phi, is a mathematical constant that has fascinated artists, architects, and scientists for centuries. This irrational number, approximately equal to 1.618, is derived from the Fibonacci sequence and is believed to represent an ideal proportion that is aesthetically pleasing and harmonious to the human eye. The golden ratio is found in various natural phenomena, such as the spiral patterns of seashells, the branching of trees, and even the proportions of the human body. In the realm of art and design, the golden ratio has been used as a guiding principle for creating visually appealing compositions, as it is thought to create a sense of balance, harmony, and natural beauty. In aesthetic medicine, the golden ratio plays a crucial role in understanding and analyzing facial proportions and features. Many believe that faces that adhere closely to the golden ratio are perceived as more attractive and aesthetically pleasing. This concept has been applied to various cosmetic procedures such as facial rejuvenation, rhinoplasty, and lip augmentation, where practitioners strive to achieve a harmonious balance and natural-looking results. The facial nerves play a crucial role in the appearance and function of the face, making their understanding essential in the field of aesthetic medicine. These nerves are responsible for the movement of facial muscles, as well as the sensory perception of touch, temperature, and pain. 1. Trigeminal nerve, cranial nerve V. The trigeminal nerve is the largest cranial nerve and is primarily responsible for sensation in the face. It has three main branches: ophthalmic, V1, maxillary, V2, and mandibular, V3. The ophthalmic branch supplies sensation to the forehead, scalp, upper eyelid, and nose. The maxillary branch provides sensation to the cheek, lower eyelid, upper lip, and nasal cavity. The mandibular branch innervates the lower lip, chin, and a portion of the ear, as well as the muscles of mastication. Number 2. Facial nerve, cranial nerve 7. The facial nerve is responsible for the motor control of the muscles involved in facial expressions. It has 5 main branches: temporal, zygomatic, buccal, marginal mandibular, and cervical. The temporal branch innervates the frontalis and orbicularis oculi muscles, controlling eyebrow movement and eye closure. The zygomatic branch supplies the muscles around the eye, such as the orbicularis oculi and the levator labii superioris, contributing to smiling and frowning expressions. The buccal branch innervates the buccinator muscle, which is responsible for cheek movement and flattening during chewing. The marginal mandibular branch innervates the depressor anguli oris muscle, which is involved in frowning and lowering the corners of the mouth. The cervical branch innervates the platysma muscle, which is involved in neck movement and facial expressions. Oculomotor nerve, cranial nerve 3. The oculomotor nerve controls several muscles involved in eye movement and eyelid function. It innervates the levator palpebrae superioris muscle, which is responsible for raising the upper eyelid. It also supplies the superior rectus, inferior rectus, medial rectus, and inferior oblique muscles, which control eye movement. Number 4. Hypoglossal nerve, cranial nerve 12. The hypoglossal nerve is primarily responsible for the motor control of the tongue muscles. It innervates the genioglossus, hyoglossus, styloglossus, and intrinsic tongue muscles, enabling tongue movement and speech articulation. In aesthetic medicine, the hypoglossal nerve is relevant in procedures involving the tongue or jaw muscles. Understanding the course and function of these facial nerves is essential in various aesthetic procedures, including botulinum toxin injections, e.g. for wrinkle reduction or muscle paralysis, surgical interventions, e.g. facelifts, brow lifts, and minimally invasive treatments, e.g. thread lifts, radiofrequency procedures. Definition of botulinum toxin. Botulinum toxin is a potent neurotoxin produced by the bacterium Clostridium botulinum. It is one of the most lethal toxins known, but when used in controlled and diluted doses, it has become a valuable therapeutic agent in the field of aesthetic medicine and several other medical disciplines. Botulinum toxin acts by blocking the release of acetylcholine, a neurotransmitter responsible for muscle contraction at the neuromuscular junction. This inhibition of acetylcholine release causes temporary muscle paralysis or relaxation, which can last for several months. In aesthetic medicine, botulinum toxin is primarily used for the following purposes. 1. Wrinkle reduction. Botulinum toxin is injected into specific facial muscles to temporarily relax them, smoothing out dynamic wrinkles caused by repeated muscle contractions, such as frown lines, crow's feet, and forehead lines. 2. Facial contouring and reshaping. Targeted injections of botulinum toxin can be used to achieve a more aesthetically pleasing facial shape by relaxing specific muscles, such as the masseter muscles for jaw slimming or the platysma muscles for neck contouring. 3. Hyperhidrosis, excessive sweating. Botulinum toxin injections can temporarily block the nerves that stimulate sweat glands, providing relief from excessive sweating in areas like the underarms, palms, and soles of the feet. 4. Migraine headache treatment. Botulinum toxin injections can help prevent or reduce the frequency and severity of migraine headaches by relaxing specific muscles involved in the development of migraines. 5. Therapeutic applications. Beyond aesthetic uses, botulinum toxin has been approved for the treatment of various medical conditions, including cervical dystonia, blepharospasm, strabismus, and overactive bladder. Botulinum toxin commercial preparations. Several commercial preparations of botulinum toxin are available for medical and aesthetic use, each with its own unique characteristics and approved indications. The most widely used preparations in aesthetic medicine include 1. Botox on a botulinum toxin A, manufactured by Allergan, now part of AbbVie, contains botulinum toxin type A, purified from the Clostridium botulinum bacterium, approved by the FDA for the temporary improvement of moderate to severe frown lines, crow's feet, and forehead lines, as well as other medical indications, comes in a vacuum-dried powder form that needs to be reconstituted with sterile saline solution before use, typically used in dilutions ranging from 2.5 to 5 units per 0.1 milliliters of saline solution. 2. Dysport, botulinum toxin A, manufactured by Ipsen Biopharmaceuticals, also contains botulinum toxin type A, but derived from a different strain of Clostridium botulinum, approved for the temporary improvement of moderate to severe glabellar lines, frown lines, and other medical indications. Comes in a lyophilized, freeze-dried powder form that requires reconstitution with sterile saline solution, typically used in dilutions ranging from 2.5 to 5 units per 0.1 milliliters of saline solution. 3. Xeomin. Botulinum toxin A, manufactured by Merz Pharmaceuticals, contains botulinum toxin type A, purified from Clostridium botulinum without the use of accessory proteins, approved for the temporary improvement of moderate to severe glabellar lines, frown lines, and other medical indications. Comes in a lyophilized powder form that requires reconstitution with sterile saline solution, typically used in dilutions ranging from 2.5 to 5 units per 0.1 milliliters of saline solution. 4. Jeuveau, Botulinum toxin A, manufactured by Evolus, contains botulinum toxin type A, derived from the same strain as Botox, approved for the temporary improvement of moderate to severe glabellar lines, frown lines. Comes in a vacuum-dried powder form that requires reconstitution with sterile saline solution, typically used in dilutions ranging from 2.5 to 5 units per 0.1 milliliters of saline solution. While these preparations all contain botulinum toxin type A, they differ in their molecular structure, formulation, and potency units. These differences may result in variations in onset, duration of action, and optimal dilution ratios for specific indications. Practitioners must carefully follow the manufacturer's instructions and guidelines for each product to ensure safe and effective use. Proper reconstitution and handling of botulinum toxin preparations are crucial for ensuring optimal efficacy, safety. Here are instructions and reconstitution guidelines for botulinum toxin preparations.